8.2 Introduction. You have learned by now the meaning and concept of counseling. You have also learned about the importance and scope of counseling. Given the fast pace of modern life where fierce competition, economic slowdown, uncertainties and mobilization from the hometown to cities / other places for jobs have become the reality, there is corresponding increase in our stress, tension, and worries also. The basic fabric of the society is changing. Families as a support system are steadily breaking down, from joint family to nuclear families and nowadays to single-parent families where the single parent is working to make ends meet. There are problems of adjustment, daily hassles of life, interpersonal issues, anxiety, depression and unprecedented challenge such as COVID-19 pandemic we are currently going through. With the increased complexities of modern life and with newer adversities coming up, there is an increasing demand of professional counselors who can facilitate the process of meeting the life challenges, to ease out stress and make life peaceful and more meaningful for people. So counseling is needed not only when we face problems, but it can also be utilized for maximizing human growth and potential, bringing out our best. The counselor who is trained and qualified can provide us the needed support and guidance for making a balance in our life, helping us to achieve overall development of personality. As part of counseling process, the counselor requires certain skills and techniques so that counseling can be effective. Since counseling is a professional practice, the counselor needs to know the important skills and use these during the counseling process. In this unit, you will understand the basic skills and techniques of counseling. Further, counseling skills and techniques used in different forms and settings will also be described. In the subsequent units 8 and 9 also, you will learn about some other counseling skills and techniques. 8.3 Rapport building. The relationship between a counselor and a client has a unique and very specific meaning. The effectiveness of counseling depends to a great extent on this counseling relationship. Hence building a relationship with the client, or commonly known as rapport building, is very important. That will determine the continuation of client with counseling process. Maintaining the rapport formed is a continuous process throughout counseling. Establishment of rapport helps in building trust and confidence on the counselor. This is required so that the client becomes open and shares with the counselor, who can then reach out to the client and understand her / his concerns effectively. Rapport building is considered as the foundation of counseling. The client is able to connect with the counselor if / he feels comfortable enough to open up and talk to the counselor about the issues or challenges. Hence it is the first requirement in the establishment of a counseling relationship, without which counseling cannot progress. Rapport building helps in creating a psychologically safe and secure environment and a trusting relationship between the counselor and the client. Developing such a relationship requires the counselor to demonstrate the core skills of genuineness, respect, empathy, along with creating an environment of trust, safety, and openness. This trusting relationship can be developed only when a confidentiality on the part of counselor is assured. Counselor needs to have listening skills, attend to nonverbal communication of the client, and use other helping skills to develop a positive climate and conditions for counseling. The counselor is also required to be non-judgmental in his / her attitude and decisions, and should not jump to conclusions or make assumptions about the client immediately. Knowing the client is the most important aspect of relationship building. The counselor can work on the following important points while building rapport with the client: setting foundation for building trust by assuring the confidentiality and taking informed consent. Let the client know that whatever he wants to share with the counselor will remain confidential if it is not going to harm the client or someone else. It is important to put stress on this point here that life is precious, and in case of threat to the client's life or others' life, we need to breach the confidentiality. If the counselor needs to break the confidence because the information that client shared is harmful to him/her or someone else, the client will not feel betrayed, as it has been informed to the client in advance. Briefing about the roles of counselor and client and developing a collaborative working relationship so that they are clear about what to expect from self and the counselor and set goals for the counseling sessions. Being predictable and consistent while giving the appointments, because consistency is one of the key aspects to speed up the trust-building process. It is important to keep the appointment. In case of an emergency, when an appointment needs to be cancelled, it should be informed to the client. Creating core conditions which are necessary for successful counseling. You will learn about these in the next section. 8.4 Person-centered counseling technique. If I can provide a certain type of relationship, the other person will discover within himself, the capacity to use that relationship for growth and change, and personal development will occur. Carl Rogers. Person-centered counseling is also known as client-centered or Rogerian counseling, in honor of its founder Carl Rogers. There are a variety of terms that are often used interchangeably in his therapeutic approach, including client-centered therapy, CCT, person-centered therapy, PCT, or non-directive supportive therapy, NDST. Rogers combined scientific rigor with the individualized practice of client-centered psychotherapy. As the name suggests, it is centered around the client. Hence, rapport formation occupies an important place, which creates a conducive atmosphere to proceed further in counseling. Rogers brought into psychotherapy the concept of self with the freedom and choice as the core of one's being. Its emphasis is on positive aspects of human psyche. It is also called so because of its emphasis on the person. The therapist believes that the client is the best authority on her/his own experience, and it asserts that the client is fully capable of changing and growing into all that the client can and wants to be if the client, like all of us, gets the warm, trusting, and acceptable environment. It is believed that a person has the potential to overcome her/his adversity, and there is a hidden or latent power in every human being to achieve the growth in her/his life. The emphasis on this positive aspect has led to call the suffering person as a client and not a patient. The basic premise of this approach is that the therapist remains non-directive and reflective and he does not interpret or advise the client. The technique /therapy provides a warm relationship in which the client can reconnect with her/his disintegrated feelings. It assumes that client will be able to find readjustment in her/his behavior if the therapist shows empathy, i.e., understanding the client's experience as if it were their own, is warm and has unconditional positive regard, i.e., total acceptance of the client as he is. Empathy helps the therapist to set up an emotional resonance with the client. Unconditional positive regard shows that the positive warmth of the therapist is not dependent on what the client discloses or does in the therapy sessions. This unique unconditional warmth makes sure that the client feels secure and can trust the therapist. The client feels safe enough to explore her/his feelings. The therapist reflects the thoughts and feelings of the client in a non-judgmental manner. The reflection is achieved by rephrasing the statements of the client, i.e., seeking simple clarifications to enhance the meaning of the client's statements. This process of reflection helps the client to become integrated. Personal relationship improves with an increase in adjustment. In principle, this therapy helps a client to become her/his real self, with the therapist/counselor working as a facilitator. Important features of person-centered techniques. Client is treated as a person, not as a patient. Client is an active rather than passive agent for the change. The client act, feel, and think. His/her subjective experiences are very meaningful and accepted in totality. According to Carl Rogers, empathetic understanding, understanding the situations from the client's perspective helps in promoting rapport building, unconditional positive regard, treating the client as a worthy person irrespective of his actions, feelings, thoughts, background, etc., and congruence. It means consistency in the counselor's thoughts, feelings, and actions, which helps client perceive the counselor as a real, responsible, reliable, and dependable person and not as a fake. Karkoff added few more conditions in the list of core conditions to Rogers' list, which are: respect. It helps the counselor to accept the client for who they are, even when they are different from you or you do not agree with them. Respect in relationships builds feeling of trust, safety, and well-being. Confrontations. It helps the client to have a realistic and accurate view about himself, others, and or his situations. Immediacy. Dealing with problems with here and now attitude. Concreteness. Focusing on specific, definite, and vivid points rather than being vague and general. And self-disclosure. Sharing personal information by counselors such as his/her thoughts, fears, preferences, and experiences. It is an important way to strengthen relationship and build trust. Thus, a person-centered or client-centered technique uses the following basic criteria, such as empathy. Empathy is seeing with the eyes of another, listening with the ears of another, and feeling with the heart of another. Alfred Adler. Empathy is a core counseling skill which refers to putting oneself in the other person's shoes. Empathy is the capacity to feel with the client, while sympathy is to feel for the client. According to Rogers, empathy is a necessary condition in counseling. He states that empathy is to sense the client's private world as if it were your own, but without ever losing the as if quality. This is empathy and very much essential to therapy. The counselor precisely understands the client's thoughts and feelings from the client's perspective. It is very important to accurately sense the client's world and verbally share one's understanding with the client. When the counselor is eager and able to experience the world from the client's point of view, it shows the client that her/his perspective has value, and s/he is accepted. Acceptance or unconditional positive regard. A therapeutic relationship is the one where the client/person is free to express himself/herself without any fear. It reflects trust and acceptance of the idea that the feelings of client are important. The counselor does not put any condition and accepts the client without any condition or judgment. This sets free the client to explore her/his thoughts and feelings, positive or negative, without the fear of rejection or criticism. It is important to remember that during the formation of new relationship, it's normal to experience feelings of uncertainty and anxiety. Such feelings can be taken care of with the counselor's positive regards to the client. In short, it is accepting and valuing another human being, regardless of their thoughts, beliefs, and behavior. Thus it indicates being non-judgmental, which means respecting and accepting the client as a person without making judgments of being right or wrong. Genuineness or congruence. Genuineness or authenticity means the consistency in behavioral expression of what you value and the way you feel and relate to your inner self. The counselor needs to be authentic and should not display an impression of I know all or only I am the best. The counselor needs to be real and be present for the client. A real human being is a person with real thoughts, real feelings, and real problems. There should not be any phony behavior. Counselor needs to be genuine in showing concern or involvement from the heart and not through pretentiousness. All fake it's should be left out of the therapeutic environment. The counselor should be aware and have insight into him or herself. This means that therapist is openly exposing the feelings and attitudes that are flowing within him or her in the moment. Therefore, there is a close matching or congruence between what is being experienced at the personal level, what is present in awareness and what is expressed to the client. 8.5 Basic Counseling Skills. Besides the core conditions described above in person-centered counseling technique, the counselors also needs to have certain basic counseling skills to help clients effectively. Some of the important skills essential for counseling are as follows. Trust building or rapport building is a very important skill a counselor should have. Building trust or rapport with the client helps the client to feel comfortable to share what he is going through without any hesitation. Attending skills means being physically and psychologically with the client. Some of the nonverbal behaviors useful in attending to clients have been summarized by the acronym SOLA by Gerald Egan in his book, The Skilled Helper. This includes OS sitting squarely facing the client. Counselor should sit attentively at an angle to the person, so that he look at them directly and show that they are listening to them and paying attention to them. Turning to sides lessens one's involvement. Have an open posture. Crossing arms and legs can make counselor look anxious or defensive and can be a sign of less involvement. Lean forwards towards the client slightly to show that counselor is interested in what the client is sharing or talking about. Maintaining eye contact shows that counselor is interested and listening to what the client has to say. It is different from staring at the client, which can make them feel uncomfortable. Maintaining good, positive eye contact means looking at the client directly and not fiddling with mobile, watch or busy with writing or any other task. Counselor can also shift the eye gaze briefly if the client is not very comfortable. One needs to be careful and understand that there can be cultural /gender differences in making eye contact. Keep relaxed body language. This helps the client to perceive the counselor as confident and relaxed. The client see that the counselor is not in a hurry to get away and are allowing the client to talk at their own pace. Active listening is engaged listening when you are listening for meaning and understanding. Active listening is very different from passive. It requires listening to thoughts, feelings, and nonverbal messages. The counselor says very little but conveys an interest in what the client is talking. The counselor speaks in between to clarify and paraphrase to communicate if client has been correctly heard and understood. Observational skills are very crucial for the counselor as it helps to observe client. There are 4 specific areas which needs to be focused for observation: body position, postures and gestures, grooming and nonverbal expressions, body language. Body language of the client includes our facial expressions, angle of our body, proximity of ourselves to another, positioning of arms and legs, etc. Observe how much can be communicated or expressed by raising and lowering your eyebrows. Make sure you observe the client objectively, i.e., observing the client as a person without counselor's own biases or prejudices. Counselors need to monitor the tone of the voice, as it is required to monitor one's body language to help understand beyond what is said. Similarly, it is important to pay more attention to how it is said rather than what is said. Counselor needs to have the skill of questioning, as it helps to get maximum information about the client without being interrogative or intruding. A closed question is one which elicits answers in yes or no or with limited inputs. It can start with what, who, do, is, are, etc. For example, did you go there? Is she your friend? Whereas an open question is one which typically starts with how, could, etc. that elicits elaboration from the client. For example, can you please tell me more about the picnic you had with your friends? Although open questions are more used in counseling than closed questions, the use of both the type of questions will depend on the type of information sought and the objectives of the particular counseling session. A probe is a question that generally starts with who, what, where, when, how, etc., which helps you in getting specific further information into a particular aspect or issue. For example, what do you plan to do after you finish college? An accent emphasizes the last few words of what the client said by repeating it, by the counselor, so that it is highlighted. A clarification question requests the client to repeat or elaborate the point mentioned by the client. The skill of paraphrasing refers to restating of what the client said, thus focusing on the content of the conversation. It helps the counselor to understand the client and be at the same page with client. It can be described as a mirror response to the client and requires active listening to the client. Sometimes paraphrasing is also used to seek clarifications. Reflection of feeling is similar to paraphrasing skill, but it focuses on reflecting on the feelings in verbal and nonverbal expressions of the client. Counselor also needs to have the skill of summarizing, which is focusing on the main points of an entire session or a particular conversation on an issue and also the feelings involved in it. Thus it highlights the important points and feelings, or the gist of the conversation. This conveys that the counselor has understood accurately what the client has conveyed. 8.6 Case history and interview. Case history and interview are two important counseling techniques that provides background data and assist in problem assessment and intervention. Taking history is an important step in defining and understanding the problem the client is facing. Case history is defined as a planned professional conversation that helps the counselor/clinician to find out about the client's problems/symptoms, feelings, fears and difficulties and get an insight about the client's illness and his or her attitude towards them. The process of taking history usually starts with collecting standard identification data about the client, such as name, age, sex, residence, socioeconomic status, education, marital status, etc. Apart from this, it is also important to note the presenting problem, symptoms, and behavior of the client. It is also important to note down the physical appearance, verbal, and nonverbal cues. Sometimes the body language and gestures can reveal more than what the client tells. So case history gives you the in-depth information about the client and his /her problems. In the beginning of taking case history, the counselor needs to assure the client about the confidentiality and security of the personal information shared by the client to the counselor. It needs to be reinforced that no information would be revealed to anyone without the permission of the client. Before opening with the history taking from the client, it is important for the counselor to think and have answers for the following, that is, what, why, from whom, and how, what information and why, what is the purpose, do I need to understand and consider the therapeutic needs of my client? How should I collect the information? Is it better to elicit the information verbally, in written form, or combine both? From whom should I collect apart from the client, if needed? The counselor can begin the process of history taking about the present problems and past problems, if any, treatment, or help sought out earlier. The developmental history, medical history, and educational/occupational history of the client, etc. are taken. If needed, the counselor may interview client's family members and friends or colleagues, after taking consent from the client. It is also important to note that the counselor should follow the ethical guidelines and legal rules pertinent for retaining such personal information of the client. Case histories serve a very useful function, as these can be straightaway used for determining the direction of the counseling process. Interview is the most widely used clinical assessment method because of number of advantages it has. It is convenient, low-cost method, consider both verbal and non-verbal behavior, flexible, and helps the clinician or counselor in building of a therapeutic relationship with the client. Interviewing is a major tool for gathering data which helps in reaching to a diagnosis and making decisions about the course of action for the treatment or intervention. Interview is a process, and not a cross-questioning session, during which the counselor/interviewer must be observant and aware of the client's verbal and non-verbal communication, such as choice of words, voice intonation, pause in between, rate of speech, facial expression, eye contact, posture, and gestures, etc. Interview serves as the basic setting for the psychological assessment and understanding of the client's problems. Though it is sometimes used as the only method of assessment, it can be used along with several of the other methods such as psychological tests, questionnaires, and observations. 8.7 Psychoeducation. Psychoeducation, as the name suggests, refers to giving education to the client and or to family about the condition or psychological state of the client. Psychoeducation is considered an evidence-based therapeutic intervention for clients and their families that provides information and support to better understand and cope with condition or the illness. It is giving information about the causes, symptoms, prognosis, and treatments of their diagnosed condition. It is the right of families and client to know about the problem, which can help them understand and evaluate their quality of life and better ways of coping with their daily difficulties. Psychoeducation is given not only for the psychological or mental conditions such as anxiety disorders, clinical depression, dementia, schizophrenia, eating disorders, personality disorders, and developmental disorders, but also for physical illnesses, such as cancer, diabetes, cardiac illnesses, etc., especially where long-term management is required. It is important to understand that psychoeducation given in an empathetic and supportive environment can help the client/patients and family members to learn problem-solving and communication skills. There is strong research evidence which suggests that psychoeducation enhances family well-being, decreases rates of relapse, and increases the rate of recovery. As a client cannot be treated in isolation or considered out of their family context, it is important to involve family members in initiating, advocating for, and supporting their relatives' mental health care. They can help in monitoring the behavior of the client, medication, diet, routine, etc., and can work like a case manager. Psychoeducation can be given one-on-one or in groups. It should be delivered by qualified health educators or professionals such as psychologists, physicians, nurses, social workers, occupational therapists, etc. Support groups can be initiated where they can exchange their experience with other patients, because mutual support play an important role in the process of healing. Care should be taken on the part of health educators / professionals not to overwhelm the client with too much information, as they already must be suffering emotionally, mentally, and socially. It should not become the source of stress for the client and the family members. Therefore, one should get a clear picture of psychological condition of the patient and how should that information be passed to the client and the family members. It should be considered how much the patient already understands, and how much knowledge the patient can take up and process in their current condition. Attention should be paid not to give too much information at one time. 8.8 Conflict resolution. Conflicts are quite a normal part of life. Conflict occurs when people perceive a threat to their needs, interests, or concerns because of a disagreement with other people, or whenever he must choose between contradictory desires, motives, or demands. In short, conflicts can be defined as situations that naturally arise as we go about managing our day-to-day activities as well as complex and stressful life circumstances. Hence it is important for the counselor to know about conflict resolution as a counseling technique so that clients can be helped in an effective manner. You may disagree with others, even if you have the best intention, which may make you or the other person involved feel angry, upset, misunderstood or helpless. To feel at peace and continue the relationship effectively, it is important to understand characteristics of conflict. Conflicts are natural and unavoidable part of life. We do have our own perspectives which are made up of complex mixture of experiences, mindsets, etc., and these are neither right nor wrong. If left unresolved, these can disturb your physical and mental well-being as well as your relationships. There are many ways to deal with conflicts and it is important to manage these in a healthy way. Human beings need respect, fairness, control, and their own space. We do have the ability to influence others, but not to control them. Conflicts can be of different types such as intrapersonal, interpersonal, intra-group, or intergroup. Aspects of conflict. Generally, conflicts are viewed negatively as these may lead to negative feelings between the people involved. At times, conflict can lead to end the relationship or creates a distance between people. If not resolved effectively, these can waste time and energy of the individuals involved in it. Conflicts can be positive as well because conflict forces people to examine a problem and find a solution, to gain new information and new perspectives, and to explore new ideas. If people want to work on resolving the conflicts, it shows their concern, commitment, and a desire to maintain the relationship. Recognize when a client may benefit from conflict resolution skills training. The counselor needs to recognize and help the client learn to manage conflict situations. Many problems and difficulties faced by the client may result from conflict. It is important to understand here that one may not be able to always fix the problem that creates a conflict, but counselor can provide clients with the skills to manage conflict effectively. Find out about clients' values before conflict resolution skills training. We all have different viewpoints that are equally justifiable from our perspective or place where we are standing. Encourage the client to see other perspective or viewpoint. Looking at the conflict or problem from different angle helps the clients become more realistic as well as find different options to resolve the conflict. It is important to bring the objectivity while analyzing the situation or conflict. This is where having a counseling intervention can benefit the client in overcoming their subjective frame of reference. Counselor can help the client understand how he filters information from their perceptions and reactions, through their values, culture, beliefs, information, experience, gender, and other variables. Apply conflict resolution skills. Teach the client about different conflict management styles such as controlling, collaborating, compromising, accommodating, and avoiding. How each one affects us and what is the best way to deal with conflicts. Teach the communication and assertiveness skills which are also very important to learn to resolve conflicts. Help the client to learn about and practice different skills of conflict resolution like win-win approach, withdrawal, suppression, win-forward/lose, compromise, etc. 8.9 Crisis intervention. Crisis intervention is one of the widely applied form of brief treatment used by mental health professionals. A crisis refers to a traumatic event or experience an individual faces in his/her life, such as natural disasters, death of a loved one, divorce, separation, accidents, robbery, fire, etc. Therefore, crisis intervention refers to the techniques applied to give short-term urgent assistance and support to individuals who have experienced an event resulting in mental, physical, emotional, and behavioral distress. According to Stuart W. Ailey, crisis intervention is emergency first aid for mental health. The goals of crisis intervention are to stabilize symptoms of traumatic event caused the distress, mitigate the impact of an event or symptoms of distress, facilitate a normal recovery process, where normal people are having normal reactions to abnormal events, restore adaptive functioning or functional capabilities, assist in decision making. Elements of crisis intervention / counseling. Crisis intervention is focused on minimizing the distress of the client due to traumatic event, offering emotional support, and expanding the individual's coping strategies in the present moment. It is meant to be relatively brief, lasting for a few weeks. That is why it is not considered under psychotherapy. It focuses on assessing the client's immediate needs and safety concerns rather than on a broad range of assessment, i.e., information gathering and case history. The following steps are followed in the crisis intervention / counseling. Assess the situation. One of the very crucial steps of crisis intervention is to assess client's present situation. This requires that a counselor listen to the client with empathy and acceptance, ask questions and ascertain how the client can cope effectively with the crisis, what resources he requires to cope, and provide him / her support. It is important here to conceptualize or define the problem while taking care of client's safety, both physically and psychologically. Educate the client. It is important to understand that having complete and accurate information solves half of the problem. Give information to client / individuals who are experiencing the crisis about their present condition and how they can reduce the damage. It is important here to note that counselor needs to help the client understand and accept their reactions, which are normal but transitory. The situation may appear grim and unending to the person who is experiencing the crisis, but the counselor needs to help the client to have hope and see that things will return to normal eventually. Offer help or support to the client. It is important for counselor to understand that during crisis counseling, client requires support, help in getting calmed, and building on the resources. It is important that the counselor maintains calmness while reaching out to the client. The counselor's skill of active listening, unconditional acceptance and empathy will play an important role in building the morale of the client. Helping the client with non-judgmental support during a crisis helps to reduce stress and improve his coping. Develop strengths and coping skills of the client. Apart from providing support, counselors need to work on building coping skills and other resources / strengths of the client to deal with the immediate crisis. Counselor can help the client to explore alternative and creative solutions to the problem, develop life skills, positive attitude and thinking, and practice stress management techniques not only during the crisis situations but for future as well. 8.10 Grief and bereavement counseling. Human beings are mortal, so grief is an inevitable and obvious part of our life. Whether we accept it or not, we all have to lose our loved ones at some or other point in life, and the loss can often knock us harder than we think or bear. Some of us can really struggle for a long period of time to cope with the loss, which may indicate necessity for some professional help to heal and move on. Before we get into defining grief and bereavement counseling, let us start with a definition of grief. Grief is a reaction to any form of loss that encompass a range of feelings from deep sadness to anger, and the process of adapting to a significant loss can vary dramatically from one person to another, depending on his or her background, beliefs, relationship to what was lost, and other factors. When we hear the word grief or bereavement, the only thing comes to our mind is the response to the death of a loved one. But if we look at the above definition, grief is explained in much broader way, which is a reaction to any form of loss. Therefore, grief can be experienced in the death of a loved one, either a human being or a pet, divorces or separation, or any other kind of significant loss such as losing a job, or the birth of a child with disability, etc. Most of us may be able to deal with the loss, but some of us may need help. So, grief counseling is provided to help the client grieve in a healthy manner, to understand and cope with the negative emotions they experience, and eventually find a way to move on in life. Kubler-Ross has given a model of grief which is quite popular. She explained that there are 5 stages of grief a person normally goes through. These are denial, anger, bargaining, depression, and acceptance, DAPCH. According to this model, during the first stage, the person does not accept the reality and is in the denial mode. The time usually taken to move on from this stage to another varies from person to person, ranging from a few weeks to months. Once the reality sinks in them, they feel the anger and usually have questions like, why me? Life is not fair, where is God? During the bargaining stage they may offer deals to higher power, the universe, or themselves. It is their attempt to re-establish control over their helplessness feeling. The bereaved person will entertain the belief that if they had only done one thing differently, such as if they would have not fought, arrived earlier, reached to the hospital sooner, worked harder, paid more attention to a spouse, etc., the person, relationship, or job could have been saved. When they realize that these beliefs and thinking now are not going to change the reality, they feel depressed. Finally, the last stage is acceptance, where the person comes to terms with the loss and accepts the new reality in her/his life. We need to understand that grief is a unique experience for every person. Every person may have their own experience and strategies to deal with that and may not necessarily go through these stages of grief. There is no right or wrong way of grieving, as it depends on the specific individual. However, when the loss and the grief starts affecting the normal functioning of the individual, it is important to seek professional counseling which will help to deal with the grief in an effective way. Techniques used in grief counseling. As a counselor, one needs to help the client to 1. Talk about the deceased or the loss, ask them about the person or the loss and allow them to express their feelings about their lost loved one in a physically and psychologically safe space. Emotional catharsis is an important part of the grief counseling. 2. Find out whether they are grieving or suffering with trauma. If the client is struggling to get an image of the mishap out of their head or experiencing flashbacks of the mishap, for example, their loved one's death, accident, etc., they are experiencing trauma, which can keep them from working through their grief. 3. Identify if they have any guilt regarding the loss. Help them to deal with the guilt, if any. Let them talk about their feelings without any fear or hesitation. The client may have the guilt feelings that they did or did not do enough for their loved one, or they may feel guilty about not crying or not feeling sad enough or moving on while their loved one is dead. It is important to take them out from the feelings of the guilt and shame. Encourage them to have commitment for self and to live a life that their loved one would have wanted for them. 8.11 Let us sum up. In this unit you learned about the importance of rapport building in counseling. Laying down the foundations of trust for the counselor, establishing the structure of counseling and forming the counseling relationship are important for the success of counseling. Empathetic understanding, unconditional positive regard, and congruence are certain core conditions which are mandatory for effectiveness of counseling. These are basic elements used in person-centered counseling technique. This approach or technique views the client as their own best authority on their own experience, and the client is fully capable of fulfilling their own potential for growth. Two important counseling techniques used by counselors are case history and interview. Further, the unit described psychoeducation as an important technique of counseling the client and her/his family about the health problem/adversity. The unit also described counseling skills used in specific settings such as conflict resolution, crisis intervention, and grief and bereavement.